Hi everyone, my name is Eliot Winkler and I'm here today on behalf of myself and my co-authors to talk about our research entitled Impact of the COVID-19 Pandemic on Deferral of Healthcare and Mental Health Service Utilization for People Living with HIV in Ontario. I have no conflicts of interest to declare, and I want to thank CAR for the opportunity to present this work. So the rationale from this project really stemmed from the changing COVID-19 pandemic. As many of us know, COVID-19 has shifted the current healthcare landscape by providing virtual services or services in a different modality, limiting the capacity of existing services and deferring care potentially for those who may need it most. Some of the continued fears of COVID-19 are the impacts on social isolation, mental health and vulnerability, as well as HIV treatment for people living with HIV, both now during the pandemic and after the pandemic has ended. So in response to that, what we really wanted to do was describe this impact of COVID-19 on care experiences for people living with HIV in Ontario. And the way that we did that was using the Ontario HIV Treatment Network Cohort Study, or the OCS. So what is the OCS? The OCS is a community-governed longitudinal cohort study of people living with HIV. I say community governed because we have a governance committee, the membership of which is made up of a majority of people living with HIV. And what they do is they oversee all the research that goes through the OCS to make sure that it is both safe and beneficial to people living with HIV. Since its inception in 1995, the OCS has enrolled over 8,000 participants. The OCS is offered at 14 clinics across Ontario, from as far southwest as Windsor to as far north as Thunder Bay. The OCS collects both clinical data and questionnaire data. And last year in 2020, there were about 2,000 questionnaires that were collected. And I wish I had more time to talk about the OCS right now, but I don't. So I really encourage everyone to go to www.ohtncohortstudy.ca to check out some of the fantastic work that's being done. So in April 2020, in response to this emerging COVID-19 pandemic, we implemented a new 35-item questionnaire module in order to capture the care experiences and psychosocial impacts of COVID-19 on the participants in the study. These annual interviewer-administered questionnaires were conducted at 13 sites distributed across Ontario. And during COVID-19, these interviews were conducted by phone, virtually, or as a modified in-person interview if it was safe to do. So as of January 5th, 2021, 1,167 participants had completed the COVID-19 module in the OCS. So for the purpose of this study, those 1,167 participants make up our cohort. So from May to December 2020, participants identified as 24% female, 76% male, and 0.8% identified as non-binary. 33% identified as heterosexual, whereas 67% identified as belonging to the LGBTQ community. Participants identified as Black, White, Asian or West Arab, East or Southeast Asian, Latin American, Indigenous, or as an other person of color. I have both the counts as well as the percents for this cohort of 1,167 participants, and you can see that here in the graph. And 37% of this cohort was born outside of Canada. So we wanted to know what types of services participants were accessing during the COVID-19 emergency. So as you'll see on the bottom here, we looked at mental health care, primary care, HIV care, and pharmacy. And I'm going to just go through this graph really quickly. So in red, in person, 2% of people access mental health services in person, 11% access primary care services in person, 18% accessed HIV care services in person, and 57% were still able to access pharmacy services in person. The light purple represents by video. So 2% of people were able to access mental health services by video, 9% were able to access primary care services by video, 11% were able to access HIV care services by video, and 7% were able to access pharmacy services by video. The dark purple represents by phone. So 8% of people were able to access mental health services by phone, 36% were able to access primary care services by phone, 28% were able to access HIV care services by phone, and 11% were able to access pharmacy services by phone. And then green represents not accessed. So 89% of people did not access mental health services, 45% of people did not access primary care services, 44% did not access HIV care services, and 25% did not access pharmacy services. And we asked participants, have you had any barriers to accessing care? So has COVID led to any of the following problems accessing medical care for you? 13.3% of participants said that the healthcare facility was closed and that they were unable to access services. 4.6% were unable to obtain the medications normally taken. And what I want to point out here, because what it's important to note, is that of these 4.6% of participants, so of these 53 participants, 38, so about 3/4, said that the medications that they were unable to obtain were their HIV medications. So some participants were unable to obtain their HIV medications during this period from May to December 2020 when they filled out their questionnaire. 2.4% of participants were unable to see their healthcare provider because they were seeing patients over the internet or by phone. And a really important limitation of our study is that the OCS was offered by phone or virtually online. So that represents a barrier that participants may have had accessing the OCS as well. And 1.6% of participants said that they had no transportation to get to their healthcare provider's office. So we asked participants, are you concerned that limited access to regular HIV care, so doctor's visits or laboratory tests, will negatively impact your ability to manage your HIV? And over 2/3 or 68% of participants said no, not at all, there'd be no negative impact. But almost 1/3 of participants expressed some level of concern that limited HIV care access would negatively impact managing their HIV. So as you see on the bottom here, 19% said it would negatively impact them a little bit, 7% said moderately, 4% said quite a bit, and 3% said extremely. And we wanted to take a look at mental health care because we know that COVID-19 is having widespread effects on mental health. So we asked participants, how much has the coronavirus emergency interrupted the care you receive for mental health? So 3/4 or 75% said, I don't receive mental health care. 11% said that COVID is having no interruption to the care that they're receiving for mental health. 7% said COVID is interrupting it somewhat, and 6% said COVID is interrupting it a lot. So for those participants who do access mental health care, over half are expressing that COVID-19 has interrupted their mental health care in some capacity. So we wanted to ask participants who had to defer their care, are you concerned that this deferral of care will impact your long-term health? So for participants who had to defer care, which was about 429, more than half had some concern that this deferral would impact their long-term health. And we saw this really striking pattern emerge where Black, Indigenous, or participants who are people of color expressed higher levels of concern about this care deferral than white participants. So on the right-hand side here, you'll see the graph where the question we asked was, are you concerned deferral of care will impact your long-term health? And we grouped the responses by not at all or a little bit, or moderately, quite a bit, and extremely. So for 61% of Black participants, they reported not at all or a little bit for concerns over this deferral of care in their long-term health, whereas 39% reported moderately, quite a bit, or extremely. For white participants, 81% reported not at all or a little bit, whereas 19% reported moderately, quite a bit, or extremely. And for participants who identified as another person of color, 71% reported not at all or a little bit, and 29% reported moderately, quite a bit, or extremely. And we asked participants who access these virtual services, how would you rate your satisfaction with this virtual care? So you'll see on the bottom here, we use the same services that we highlighted at the beginning. So mental health, primary care services, or HIV care services, or pharmacy services. And across the board, between 75 to 92% of participants were quite satisfied with their virtual care. And we asked all participants in the study, if these virtual services were offered in the future, how likely would you be to choose these services? And for each of the services reported below, we saw that over half of participants would be likely to choose these virtual services in the future. And that's quite promising because we know that with this evolving healthcare landscape, we know that virtual services will likely continue to be offered after COVID is over. So in conclusion, over 1/3 of participants were able to access their HIV care via phone or video appointment. However, 2.4% had no access to phone or internet and were unable to access their care. 1/3 of participants thought that limited access to HIV care would negatively impact their ability to manage their HIV. And for participants who were unable to access their medications, which was 4.6%, almost 3/4 of that 4.6% indicated it was their HIV medications that they were unable to obtain. Almost 15% of participants reported COVID had interrupted their mental health service use in some capacity, and more than half of participants who deferred care had a concern it would impact their long-term health, with Black, Indigenous, or participants who are people of color expressing greater levels of concern than white participants. And over half of participants would be likely to choose virtual HIV care and HIV support services in the future if they were offered. So again, the OCS is a large study, and it takes quite a large amount of people to help run it and support it. So thank you to all of the people listed on this slide for all their help with the OCS. So thank you so much for your time. If you have any questions at all, my email is here for you to email me. Thank you again.